Hi, myself Muhammad Awes, 2K21 batch, student of the second professional BMS, Government Tibbi College and Hospital, Patna. Here we will discuss about viral hepatitis. Video presentation under the supervision of Dr. Tanveer sir, Dr. Malika ma'am, and Dr. Talat ma'am. So let's start now. Viral hepatitis. It means it is caused by five different viruses with transmission either through contaminated food or water. Hepatitis A and E are through exposure of the blood or body fluids. Hepatitis B, C, D. Now started hepatitis A. Hepatitis A is formerly known as infectious hepatitis or epidemic jaundice, caused by a hepatitis A virus. Symptoms of the hepatitis disease hepatitis A is fever, chills, headache, pain, followed by anorexia, nausea, vomiting, dark urine, and jaundice. Endemic in most developing countries. Epidemiological determinant is A virus. Enterovirus type 72 of Picornaviridae family. Reservoir of infection is human cases. Infectivity period 2 weeks before to 1 week after onset of the jaundice. Infective material is man's pigs. Host factor is children. Environmental factor heavy rainfall, poor sanitation, overcrowding. Modes of transmission is fecal-oral route. Incubation period is 28 days. Clinical feature is nausea, vomiting, anorexia, mild fever, jaundice. Prevention and control. Control of reservoir, control of transmission, and vaccine. Combination with hepatitis B and also with typhoid vaccine and provides immunoglobulins. Now started to hepatitis B, formerly is known as the serum hepatitis, account for 45% of the cases of hepatocellular carcinoma and 30% of the cirrhosis of liver. Is highest in sub-Saharan Africa and East Asia. Epidemiological determinants of the hepatitis B virus. Epidemiological determinant of hepatitis B. Agent factor agent hepatitis B virus, double-celled DNA virus. Originally is known as DAN particle. Reservoir of infection, man is the only reservoir. Infective material, contaminated food, contaminated blood, body secretion, that means saliva, vaginal secretion or semen. Or host factor agent, acute hepatitis B, chronic hepatitis B. High risk groups, surgeons, recipients of blood transfusion, organ transplants. Mode of transmission is parenteral route, blood. Incubation period is 75 days. Prevention hepatitis B vaccine and pentavalent vaccine. Hepatitis B vaccines. About hepatitis C. Hepatitis C is a contagious liver disease that results from infections with the hepatitis C virus. Lifelong illness, major cause of the parenterally transmitted hepatitis. Hepatitis C virus is most commonly transmitted through exposure to the infectious blood. Incubation period is 2 weeks to 6 months. Symptoms, approximately 80% of the people do not exhibit any symptoms. Fever, fatigue, decreased appetite, nausea, vomiting, abdominal pain, and jaundice. Treatment of the hepatitis C is the hepatitis C does not always require treatment. Chronic infection do not develop liver damage. Prevention, primary prevention, hand hygiene, self-handling, disposal of waste. Here now we will start it about hepatitis E, caused by hepatitis E virus, HEV. Waterborne disease होता है, formerly termed enterically transmitted hepatitis, non-A, non-B hepatitis. Hepatitis E virus, hepatitis E virus has four genotypes: type 1, 2, 3, and 4. Transmission of hepatitis E virus is fecal-oral route due to the fecal contamination of drinking water. Incubation period is 3 to 8 weeks, mean 40 days. Symptoms is jaundice, loss of appetite, abdominal pain, tenderness, nausea, vomiting, fever in large tender liver. Symptomatic infection is more common in young adult age 15 to 40 years, frequent in children. Diagnosis not clinically distinguishable for other type acute viral hepatitis. Treatment hepatitis E is usually self-limiting. Prevention is most effective approach. Hepatitis D. Hepatitis D. Hepatitis D caused by hepatitis D virus required hepatitis B virus for its replication. Hepatitis D cannot occur in the absence of hepatitis B. Routes of transmission is same as the hepatitis B virus. Diagnosis designed by the IgG. Treatment, no specific treatment for acute or chronic hepatitis D virus. Prevention and control of hepatitis D infection requires prevention of hepatitis B viruses through the B immunoglobulins and one another